The ketogenic diet has been quite the buzzword recently, and for good reason. There are many purported health benefits of the diet, ranging from weight loss and lowered inflammation to improved energy and even cognition. Currently, there are almost 100 clinical trials open or about to start recruitment of patients to see if the beneficial effects of the diet are true. So what is the diet, exactly? The ketogenic diet is a high-fat, moderate protein, and low-carbohydrate diet. It restricts carbohydrates coming from bread, pasta, rice, crackers, sugar, root vegetables like potatoes, and most fruits. The diet is a well-established medical treatment for refractory pediatric epilepsy or for children who have seizures and do not respond to their anti-seizure medications. Its first documented use in the United States has dated back to the 1920s. Despite this, we currently have very few human studies with evidence supporting its use in different diseases, such as cancer. This, in addition to the diet getting great attention in the media, has led to a lot of confusion as to what the keto diet is and what it is not and who would benefit from it. Can the keto diet be helpful for cancer? The connection between the ketogenic diet and cancer has everything to do with how cells behave. In his research, Nobel laureate Dr. Otto Warburg discovered that 80% of human cancer cells have an increased intake of glucose and, without the presence of oxygen, produce very little energy. This is incredibly unusual in comparison to normal energy metabolism, where a small amount of glucose yields a large amount of energy in the presence of oxygen. In other words, this guy discovered that the metabolism of most cancer cells is altered. So where does the keto diet come in? Using the ketogenic diet, we can potentially change the tumor's metabolism by reducing the amount of glucose and other nutrients, like insulin and insulin-like growth factor (IGF-1), it gets to feed on. This can reduce the blood flow going to the tumor, making it much less favorable for cancer cells to grow. Research has already done on this, with a recent study showing that for obese endometrial and ovarian cancer patients the keto diet helped reduce their fat mass and insulin and IGF-1, thus potentially decreasing their tumor burden. There are studies now looking at how one of the ketone bodies, compounds produced in the body when a person is on the keto diet, can actually function as an antioxidant to help minimize damage to other healthy cells. What type of keto diet is best for cancer? There's an ever-increasing amount of evidence to support using the keto diet in cancer patients, specifically with brain tumor patients. We use the term classic ketogenic diet in our brain tumor clinic when we are talking about a 3-to-1 ketogenic diet. This translates to about 80% of total calories coming from fat, or 1,600 calories coming from fat alone for someone eating 2,000 calories a day. This specific ratio is considered to be the most therapeutic for a few different reasons. We are currently using the diet in our Phase 1 clinical trial in patients within the first 3 months of a diagnosis of a type of brain tumor called glioblastoma multiforme. We are using it either before, during, or after their standard treatment of oral chemotherapy and radiation. During this time, many patients are on steroids, which have the very well-known side effect of raising blood sugar. Having 80% of calories coming from fat ensures that patients can achieve ketosis despite this side effect. Another reason being that most, but admittedly not all, patients with brain tumors have seizures. Fat provides 9 calories per gram and a steadier stream of energy, creating a less favorable environment in the brain to have a seizure. Lastly, if planned correctly,